Welcome to Military Network Radio, where we'll bring dynamic interviews and fresh information about topics affecting your quality of life at each stage of your military service. Join us each week for information of value that improves your outlook, actions, and encourages each member of the family. Serving the military, their families, and those who care about them. Everyone serves, and together we make a difference. And now, here's your host, Linda Crater.
Welcome to Military Network Radio this morning. We are delighted to bring you a very interesting show that I think will bring some information to light that you probably haven't heard before. The name of our program today is Dizziness and Balance Issues. Is it brain injury, vestibular disorder, or something else? We have three amazing guests with us, pardon me. We have the Managing Director of BalanceBack, Marie Cosgrove. Welcome, Marie.
Thank you.
And we have the Director of Clinical Research and Education for BalanceBack, Dr. Sal Grudefaria. Welcome, Sal.
Thank you for having us.
And we are very privileged to have an active duty service member who we will go by first name only. Welcome to Chris.
Thanks a lot, Linda. I appreciate it.
You're very welcome. Today joining me is Pamela Stokes-Eggleston as our co-host. And just a little bit of background. We're talking about balance disorders, dizziness, etc., because those with TBI can have as much as 30 to 65% of them who suffer from this dizziness, lightheadedness, vertigo, and motion intolerance, which can really be very confusing to diagnose. I met Marie at a conference 2 weeks ago, and we were talking, and she mentioned that her company, BalanceBack, has this amazing device that can diagnose and point treatment in the right direction. Is it neurological? Is it vision? Is it vestibular, meaning inner ear? Is it caused by meds? Very interesting. So BalanceBack is the name of their company, and we are going to have a very open discussion today about the disorders, how to diagnose, how it works, where you can find out more information. And we are delighted to have you all here today. Welcome to Military Network Radio.
Thank you.
You're welcome. Marie, maybe you could start with how this lack of diagnostic tool was first noted, how it came to be, and how you're using it in the military veteran population.
Well, unfortunately, we don't have enough outreach, but we're trying to get out there. We do, for example, Salisbury VA Medical Center in Salisbury, North Carolina, is using our equipment as well as some of the Air Force bases across the country. How our system came to be was because of the lack of diagnostic tools that were available to clinicians. Mm-hmm. So a group of clinicians got together with the world's best engineering team in Dayton, Ohio, specifically Dr. Scarpino, who leads the engineering team and has invented technology for tracking for Predator F-15, F-16, and incorporated that technology into our diagnostic equipment to better diagnose patients. And how that is related is that the eyes are interconnected with the ears, and all of that is interconnected. And when a patient has balance disorders, they've got something called nystagmus, an abnormal beat of the eye. And it's important to track the eyes while the patient is looking at a stimulus to be able to identify where the pathology lays. And so the technology was never really advanced in order to be able to do proper diagnosis. Now, there has been testing, but it hasn't been very accurate. So the clinicians developed the BalanceBack system to improve the diagnosis and to improve treatment. So there are two different components, and Dr. Grudefaria can speak more into the clinical aspect of it since he is the clinician, but there's two parts to it, and one of them is the VNG system, which assists in diagnosing, and then we have our computerized dynamic posturography, our treatment balance therapy system that works in conjunction with the diagnosis. So first they use one tool to diagnose, to determine where the pathology lays, and then they use the other tool for treatment. And the neat part of it is that the doctors are able to diagnose, and they're able to treat or determine the appropriate treatment, because sometimes it may be something completely different that can be treated with pharmacological or physical therapy, or something called like an Epley maneuver or Cantaloupe maneuver, and Dr. Gudatoria can get deeper into that. And then we have our therapy.
Marie, hang on one second. I have a couple of things I'd love you to define in more layman's terms for people. So if I understand this correctly, first you're taking a look diagnostically with goggles, basically, to track the eye movements. Is that correct?
That is correct.
And that's the part that you used a really big word that doesn't matter that we don't know. That's okay. But there's goggles that they look at because the eyes, the ears, the balance, as you said, are all connected. So that's very important. The other point I wanted to bring out is that when you're talking about the other balance disorder, the balance issues, we're talking about things to avoid falls, to prevent the dizziness, the crumpling. I know many a caregiver who has become very injured grabbing someone who's falling. So the very practical issues of inner ear or TBI or these things that you're going to diagnose are very practical. So as much as possible today, if we can talk about how it relates exactly to those undergoing these issues, you're doing a great job. I just think that some of these words are a little much for me. How you feel about that, Pam?
I feel the same way. I mean, I'm following, and what I had actually discussed with Linda earlier as I was doing research on this show is the technicality of a lot of this. And I think as a caregiver myself, and for other caregivers and military families to truly understand the benefits of this, I think this is really a wonderful program that you guys have to be able to explain it to folks, in layman's terms, like, so they can say, okay, this is what they said, and this is where I want to find the information and see which hospitals are using it. I think that was a good mention about the Salisbury
I love
Hospital.
that.
Yeah.
And I think that's why we'll ask you some questions that will sound obvious, but I think when people relate to, oh my gosh, you mean to say that there's a possible answer for something they told me to live with? I know that at Walter Reed, this is before it moved over to Bethesda, there were many a soldier that were being sent on with double vision, telling them it would cure over time. Balance, no, you had a concussive disorder from a TBI. It'll just take time and go away. What you're saying is you can actually pinpoint if it is a TBI, if it is vestibular inner ear, and then you can direct the physicians for treatment. Am I correct in saying that?
Yes, and my apologize.
No, don't apologize. Because we are really trying to make it accessible. So, no, you're doing a great job.
Right, and yes, absolutely. There is, unfortunately, patients go and diagnose up to 5 years when they have balance disorders, and there is a tool out there that will help identify if it's an inner ear or if it's neurologically based central nervous system, which is in the brain. It could be a tumor, migraine, something of that nature, or it could be inner ear. Now, the majority of the cases, when it's a balance disorder, it is an inner ear problem, but it is determining, is it the right ear or the left ear? In which side is it in, so that the doctor can do the appropriate treatment? So that's really important. And the neat part of it is that there's over a 90% cure rate if it's an inner ear problem. And even if it's a central nervous system problem, if it's in with the brain, there's also cures that can be provided for the patient if it is identified early enough. And so that's why this tool is so important for clinicians, so that they're able to identify what's causing the issue and they can provide the appropriate treatment.
And that's what was so interesting to me, is because it could be neurological, it could be vision, it could be the inner ear, it could be caused by med, it could be blood pressure drops. And you all take it, and instead of having a host of physician specialists to determine the cause, which sometimes will happen and sometimes will not, depending on the availability, you can actually pinpoint it and make it more efficient.
Right.
Yeah, this is Dr. Gregoria, and let me just step back a little bit just to talk about the importance of what we do. You talk about falls, and you talk about balance problems, and you talk about caregiver problems. First of all, we know that many physicians kind of throw their hands up in the air and say, I don't know what to do with these patients, because these patients, come in with chronic complaints of balance problems and dizziness, and the physician in their examination just cannot see what's wrong with them. So oftentimes these patients are medicated, and medication many times is not the right answer for these patients. In fact, medications sometimes will actually inhibit the person from getting better because it masks out the symptoms. We know that in order to get somebody to move appropriately, they have to practice moving. If they don't practice moving, then they are not going to get better. As the person with these problems get older, we know that falls are the number one cause of accidental death in the elderly. We also know that dizziness and balance problems are the number one complaint that all elderly people go in to see their physician about, and it's the number 3 complaint of all patients of any age group who go to see their physician. So we're talking about a problem that is huge. What we look at with our system and the type of therapy that we do is that the balance system can't be isolated into just vestibular. It is part brain. It's part vision. I mean, think about it. You can't walk a straight line if you can't see where you're going. It's proprioception, how your feet feel on the ground if you're walking on a smooth surface or an uneven surface. Those things affect our balance. And then
Sal,
comes
excuse me a second.
Play.
We have to go on commercial break. We will be right back. You're listening to Military Network Radio.
.com.
Welcome back to Military Network Radio, serving the military, their families, and those who care about them. Together, we make a difference.
Welcome back to Military Network Radio. We're here with representatives from BalanceBack, a wonderful diagnostic tool that helps with dizziness and balance issues that may be caused by brain injury, that may be inner ear. And we were hearing from the Clinical Research and Education Director, Sal Grudefaria. And perhaps, Sal, you can continue on with your discussion of how it is that you do differentiate between these and the value of this diagnostic tool in providing an early diagnosis so that treatment can be followed along the correct path.
Well, we do know that anybody who's experiencing dizziness and balance problems, it can be very debilitating. It not only affects your employment, I mean, because think about it, if you are dizzy, at work, many of us, have jobs that dependent on us being able to drive and being able to walk a straight line and being able to balance, but it also affects us socially. There are many, people that just have to sit in the house because they are afraid to get up and walk out of the house. So it affects their family. So diagnosing these problems, the earlier, the better. And we also know, we mentioned falls, and we also know that because there is the tendency for these folks to fall, we know that falls can be very debilitating, too, especially as we get older. So the sooner we can correct these problems, the better. There are some problems that often go misdiagnosed that we can fix in one therapy session. So people are experiencing severe bouts of vertigo, and I'm specifically talking about a disorder called BPPV, benign paroxysmal positional vertigo. It often happens after a head injury, and sometimes we don't know why it happens. It just happens spontaneously. But if it is appropriately diagnosed, we can fix this debilitating disorder in 1 or 2 therapy sessions.
You know, depression is such a big problem for a lot of our vets when they come back and nobody knows what's going on. So if you're able to find a problem early, that can have far-reaching consequences for the entire family.
Absolutely.
My goodness. Pam, your husband had a TBI. Did he have any of these issues?
He did in the beginning. I mean, because when they diagnosed him, it was mild originally. They said mild. You had that small M in front of the TBI. Mm-hmm. And as he's been working with NIH, it's probably graduated to moderate, which I knew. I mean, I'm living with him, so that mild stuff, I think they were telling people, to make them perhaps feel better or feel like they were more in control than they really are. And really, people that are diagnosing these types of illnesses need to, I think, get better educated. I think in terms of balance, Charles didn't have any issues with balance. I had him doing yoga. He'd come right up in the tree. The balance thing wasn't it for him. But we had lots of friends who were dealing with concussive and TBI-related issues that did have balance issues, and were going to the new Walter Reed, as I like to call it, where they have the Intrepid Center, and they were doing that kind of those activities in the balance kind of machines that they were using there to help them through some of this. And so for me, it's really nice to hear about this project and the fact that you guys are in the VA hospitals, that you're on bases, because it's really needed. And with things like TBI, with brain, any type of brain injury, any type of things focusing on the mind is kind of an enigma, even within the medical community. A lot of times when people don't know, they don't say, we don't know. And that would just be a lot helpful, because at least we can, or more helpful, because we could go to somebody like BalanceBack and say, okay, if they don't know, we can take the next step here and use this tool. And so I'm wondering, and Linda spoke on it earlier, how early would the detection need to be, would the diagnosis need to be for BalanceBack to be fully 100% beneficial?
Well, this is Dr. Vittoria again. It is, it could be right away. Absolutely right away. So some injuries take place, say, for a viral infection. And the person is suffering from, severe dizziness and balance. Well, we can test that person, right away as soon as they're able to, get out to come to the clinic and in the office. So, the diagnosis takes place right away. We don't have to wait a period of time.
Oh, that's great. And so if somebody was dealing with TBI but didn't really know what they were dealing with for a few years, and then they came in and they got the diagnosis and you guys would be able to help them, would it still be as effective, or would you have to do something a little different?
No, absolutely. It's never too late, for the diagnosis. Now, the therapy that we recommend may change because of, the time that has gone on since the initial, injury. But it's never too late to diagnose, and just because it has been a long time, it doesn't mean that the person isn't going to improve. The key is to finding out what is wrong, and then after finding out what is wrong, giving them the appropriate therapy to make them better.
Right.
I am so encouraged by that, because I believe that I've heard at least 20, 30 times that if you don't get to TBI symptoms quickly, it's lost time forever. So that is a phenomenally positive statement to hear, even though you're telling me that the treatment might change. That's very positive. Marie, do you have more to add to that?
Yeah, I agree. It's great that we can still provide help, but I believe it's still important to get in as early as possible. Because the sooner you get in, the sooner, of course, we can provide treatment, and the easier it'll be to assist the patient before the condition worsens for the patient.
I agree, and Pam, you know these people too. I know at least 5 people who are at home dealing with issues that are not going away, that are affecting their ability to hold their jobs down, that are affecting their relationships, and that are not being dealt with in a way that makes a better quality of life. And so this is phenomenal. Chris, we've had you on and you've been so quiet. Thank you so much. Chris is a service member who has been treated with BalanceBack, and maybe you tell us your story.
Sure, absolutely. I did want to say that just to help, I don't know, kind of cage everybody's thinking, I am a U.S. Marine, and I've been in for 20 years now. And the way that I actually got introduced to it, it's funny, you said, right when you said quality of life, I was taking some notes, and I said I'm going to make sure to mention the quality of life difference between then and now. So I'm glad you touched on it. But I got injured over in Afghanistan, and while I know that a majority of the conversation has dealt with balance issues with regards to TBI, I think that there's another side of the house that balance issues can come to play, and that's just from a physical injury. Nothing having to do with mental or anything of that nature from an injury of the head. I had a severe back injury, and I apologize, Doc. You probably know the proper terminology and lingo, but basically my spinal column collapsed. I had some excess weight that I was trying to move around, and the spinal column collapsed. The L5 vertebrae, the vertebral body, slid so far forward that it was almost a paralysis issue. It really hurt. And I suffered with it for quite a while. And about a month after the injury occurred, now there was some other causal factors. It was just basically a time bomb waiting to happen. I've got some degenerative disc disease, and I believe it's called spondylosis, and some other little bitty nagging things that built up. All of a sudden, an acute injury occurred, and that's what set me on the motion to actually experience the BalanceBack equipment. When I got back from Afghanistan, I was stationed at Marine Corps Air Station Miramar in San Diego, and I saw my flight surgeon as a pilot. He was my first guy that I went to see, and he directed me to go over to the SMART clinic that there on the base, and to see a Navy captain retired, Dr. Joe Moore. And once he had finally diagnosed me and all the X-rays and everything else, he escorted me down to the Naval Clinic there in San Diego, and my surgeon made a statement that I never forgot. He told me 2 things. He says, one day you will absolutely have surgery. There's absolutely nothing that we can do about it to stop that from happening. He said, and the second thing that he told me, he said, today is the best until that surgery happens, today is the best that your back is ever going to be. Tomorrow it's going to be a little worse, and the next day, et cetera, et cetera. He was just basically trying to keep it real for me. I did leave there with the wind taken out of my sails, to be perfectly honest. So,
Yes.
But anyway, so what we did at that point, Doc Moore, he began to realize and said, okay, we've got to figure out a way to treat this. We need to exhaust every option. And based on my desires of not getting surgery, delaying it as long as possible, he came up with a plan to strengthen my core, to try to get everything around that weak spot in my back to carry the load as much as possible. And one of the main pieces of his training program for me was this particular piece of gear, this BalanceBack. And I'm here to tell you that about a month and a half after the injury occurred, I was down in the surgeon's office, and he actually, one of the other things that he told me that day was, he said, you're a candidate for surgery right now. He says, but I would rather us try to do everything that we can do to try to stave that off as long as possible, but just know your back is bad enough to have surgery now.
Chris, I'm going to stop you now because we're going to go into a break, and this is suspended suspense, actually. And I think this is a great story. We will be going on break, and we'll bring you back right after break to continue this story. You're listening to Military Network Radio. We're here with representatives of BalanceBack, Marie Cosgrove, the managing director, Dr. Sal Grudavaria, and service member Chris, who was helped by this technology. We will be right back. Welcome back to Military Network Radio. We are listening to Chris, who was telling us his story about his severe back injury and his experience using the BalanceBack tool and his treatment. So, Chris, if you would continue, I would love to hear the rest of this story.
Well, I'll tell you, I'll save the punchline for the very last part of it, because I think when you hear how long. Well, I don't want to let it out of the bag. Let me just go ahead and pick up where I left off. Like I was saying, Dr. Moore got with me, and based on, I was very adamant that, yes, though the surgeon said that he would, basically he was going to do a spinal fusion, an L5 T-lift, and he was basically going to weld the vertebral bodies together to keep them in place, because there was nothing that they could do to keep it from sliding out of socket, so to speak. And every time it did, it was absolutely crippling. Mm-hmm. So that's where when I got together with Dr. Moore, and we said, okay, we're going to strengthen the core, and we're going to delay this as long as possible. And one of the things that he implemented was the BalanceBack machine. That's what I call it, but the piece of equipment there inside the Smart Clinic. And I got to tell you, I have since had the surgery, and I am recovering nicely. It was about a year and a half ago when I finally had the surgery. But I will tell you, from the moment that I got injured, from the moment that I had that meeting with the surgeon, I've actually got it written down. I was able to delay actually having that back spinal surgery, that fusion, 3 years, 5 months.
Wow.
An entire 3 years. And he was prepared to do the surgery within a month or so after our first meeting. And I was able to delay that almost 3.5 years because of the core strengthening program that Dr. Moore had gotten me on, and I would not have been able to do that were it not for that BalanceBack piece of machinery.
How does it work? Can you explain it?
Well, it's a balancing, it's basically a balancing act. Imagine you've seen, I guess the only way I can describe it over the radio, because I'm a visual person with my hands.
Go ahead and draw. We'll watch.
Would you watch this? Okay, good. You've seen elephants stand on a ball at the circus or something, and that's effectively what you're doing. You're balancing yourself, and you're trying to maintain that. It's very easy to go out of balance, and so you're constantly tensing and strengthening and squeezing your inner muscles to try to maintain your posture. And ultimately what it does is that it ends up strengthening your core, because you're so sore the next day because you're using muscles that you had no idea that were there. And so that's how he had me on. He had me on a program with that, along with some other rehabilitation type machinery, but that's what he had for me.
So, Marie, the BalanceBack mobile, is that what he's talking about, where he's standing in a explain it a little bit, because
Sure.
I've seen it online, but our listeners probably haven't yet, although go to balanceback.com if you want to see it. But go ahead, Marie. Sure.
Well, there's two. The one he's talking about is the not the mobile, the other one. They're both basically identical. The difference is that the mobile is meant for clinics that want to take their equipment to different offices. If they have several offices and it's more mobile, if they want to use it in a home setting, for example. But what it is, there's like a balance plate, and we're able to adjust the stability of that plate. It has a 360-degree sway, and we're able to adjust the difficulty of that. And what it actually is doing is we're able to the human body uses 3 sensory inputs to maintain proper balance, and they're vestibular, which is the inner ear system, somasensory, which is the feet, ankles, joints, and vision, eyes. So we're incorporating all of these things into the system. The patient stands on this balance plate. We adjust the difficulty level, and we make it, at the beginning, we make it as easy as possible, and as they come in for different sessions, we make it a little bit more difficult. And we try to stimulate real life situations. So the patient will be looking at a screen, they will be using their visual, and we have different types of games, and we've incorporated 3D games into it as well, so it makes it fun for the patient. And they feel like they don't feel like it's a workout or like it's actually hard work. We try to make it as fun as possible and interactive for the patient. And as Chris stated, they're using parts of their body that they've never used before. And this helps improve their visual perceptive. It helps improve them overall for balance, and also core strengthening. So patients, for example, that have had injuries, even athletes who've had injuries and they want to get back into their athletics, this helps improve their entire system to be able to do that. Chris, do you remember what type of games you played on the system?
You know what? I'm sorry, I surely don't. But
you don't? Okay, that's okay.
I'm sitting here listening to the description and everything, and that's absolutely right. It was the screen that was up there, and I got to tell you, it's tricky. It's tricky. And of course, Dr. Moore, he worked me pretty hard. I guess he figured I could handle it, and
you are a Marine, you know.
Yeah. Sometimes that works against me because I really wanted to slack because I was hurting really bad, and but you know, he knew that he needed to push me and to help me push myself, and so. That particular, the balance therapy, I'm looking at a picture of it now online. It wasn't the mobile, it was the balance therapy model. And you don't realize just exactly how hard you're working until about 3 or 4 minutes into it, and then all you want to do is just lay down because you really are working hard. And I'm not surprised that it was able to extend 3.5 years before I had surgery because the machine worked me to death.
Yeah, there's and it's totally customizable to the patient. So each program, and I'm sure Dr. Moore, he must have put the hardest level for you, but it's all to help the patient. And so each time the patient comes in, it also gives the doctor a report to show them where the patient was at in the beginning of time and each session how they're improving. So it's all outcome based, and so they're able to change the protocol to make it more difficult so the patient can keep improving.
That's absolutely right. I can remember, and please refresh me a little bit on this, but I remember it being kind of easy to begin with, and then as we went along over the course of about 9 or 10 months of using it, it seemed to get more and more difficult, and by that I'm meaning the pivot point, the pivot stand that you're standing on that's moving in that 360-degree rotation you mentioned. It just seemed to be really easy to move as he changed the settings. So maybe he got rid of some of the tension and things as we went along. He didn't really tell me about it. I think he just did it behind my back, so I wouldn't know how hard he was pushing me.
Benefit.
Right.
Well, he is Navy, and I am Marine, and when they always say the Marine Corps is a department of the Navy, and I have to come back and tell them, yeah, that's right, the men's department.
Oh, my goodness. Sal, I have a question for Sal. Does it matter whether the diagnosis is a brain injury or vestibular for the treatment?
Well, yes, it matters because you're going to design the treatment according to the problem that the person has. But the biggest thing is not necessarily the diagnosis. The biggest thing is the symptoms that the person has. So what you want to do is you want to treat the symptoms that the person has, no matter what the diagnosis is, so that you can make each one of those symptoms go away. You can make each one of those symptoms better.
The other thing that's absolutely brilliant is the integration of the visual, the balance, the inner ear, the feet and the ankles, plus the 3D games. I mean, because I think we all know that there's a lot of gaming going on by many, many service members and veterans and their families as well. So it's brilliant when you integrate it all so that, yes, it's therapy, and yes, it's hard. I'm sure of that, Chris. But you also have things that kind of can distract you as all this treatment is going on. Would that be accurate to say?
Absolutely.
Yes.
I agree 100%.
We recently added more 3D games. We added about 6 or 7 additional games. So, Chris, you may not have tried those, but they're pretty cool.
Well, see, now, I don't want to get hurt again to use it, but maybe I'll just go back in and tell them I'm a veteran of BalanceBack. They should give me a free trial run on it again.
Absolutely.
I think
if you ever want to come
the VA may have different ideas, but okay. That's tremendous. Anything further you'd like to add on the treatment? Because it sure sounded like it helped you post-surgery as well as pre-surgery. Is that correct, or you only used it pre?
I only used it pre, but I'll tell you this. It not only helped me stave off just the actual surgical procedure itself, but it also improved and it helped me. I couldn't straighten up. Mm. I was literally hunchback. I'm 6'3", about 215. And, with that injury occurring so low in the spinal column, that's a long moment back to my physics days. That's a long moment to the top of my head and a lot of weight whenever you would move left or right. So, I would try. My body was automatically compensating to try to find the least painful position to be in, which was absolutely the worst possible posture. It completely ruined my gait. I couldn't sit in my vehicle straight. It just was horrific. And this machine helped me not only stave off, like I say, the surgeon's knife, but it also improved my posture to stand, to walk, which also improved my quality of life across the board pre-surgery now. Now, I continue to degrade, but it had nothing to do with the therapy and the treatment. That was a given fact, as the surgeon had told me upon our first meeting. But it slowed down that degradation significantly.
Sal, maybe we have about 2 minutes, a little less than that, before the next break. But I would believe that what this does also is add hope. If you can remove some of the pain, you can act as though you are doing something to help these disorders. You're also helping the mental health of your patients as they prepare for whatever comes next.
Oh, you're absolutely right. I mean, a lot of the issues are psychological issues that somebody experiences when they lose mobility. And if they are doing something, if they are actively involved in their treatment, it helps them mentally to feel that they are actually doing something to improve themselves.
It's also a control. When you feel out of control when you're in pain, and it can be debilitating. So the fact that you are involved in treatment is something that is incredibly strong. It's absolutely brilliant. Marie, anything to add before we go on break? We have about 30 seconds.
No, I was just, Dr. Gudeturi is absolutely right. And it's so true. If you go undiagnosed with dizziness, it could definitely add to your mental well-being. And so that's why I feel it's important to get, diagnosed early, because a lot of times patients are even afraid to tell their doctors that they have balance issues. They'll go in for other issues, but they won't mention that they have dizziness or balance disorders, and that doesn't come in till later, is what we found with some of our clinicians.
Well, I think service members are also very good at sucking up, and something like that may seem minimal compared to the rest. We're going to go on break, and we will be right back. You're listening to Military Network Radio.
Welcome back to Military Network Radio, serving the military, their families, and those who care about them. Together, we make a difference.
Welcome back, everyone. We are talking about BalanceBack and balance issues, inner ear dizziness, a lot of things that may be bothering a number of you. Sal, I'll go to you. Can you describe these symptoms that people may have that might prompt them to reach out and ask their physicians about either this tool, where to find it, about additional testing, about not living with something that has been making them miserable, because there really may be an answer?
Sure. Well, anybody who is experiencing dizziness, lightheadedness, the feeling of being off balance and not being able to walk straight, difficulty in navigating in the dark is a big one because you may be using your eyes to compensate for a vestibular problem. Difficulty on maneuvering on uneven surfaces. Dizziness when laying down or turning over from side to side. The feeling of being nauseous from the dizziness. Sometimes there is a concurrent hearing loss because the balance system is located in the ears. Mm-hmm. Any of those things that somebody is experiencing should prompt them to seek help from their physician and for balance and vestibular testing.
I did find one fact that you probably know, and I don't want to dwell on this, but I did read where anti-malarials that were used in Somalia, OEF, Africa, and Southeast Asia can also cause vestibular dysfunction.
Yeah, absolutely. And some of the other things, too, for example, some of the chemotherapy, that we may have for cancer can be toxic to the vestibular system.
Amazing. I didn't know those things. So, Marie, right now it's you said you did not have your list, so I won't put you on the spot for that, but it's at a number of military hospitals, but they appear to be few and far between, and this seems like an amazing tool that people could use. So the ones that I noted were Camp Pendleton, Walter Reed at Bethesda, San Diego Medical Center, Elgin, Womack at Fort Bragg, and I'm sure that we're looking at getting it elsewhere, but I know that, Chris, your testimonial alone shows that it really did help in making you have some quality of life back again. Plus, it allows you to keep on working, which is huge in terms of mental health and just having a purpose.
Absolutely. I could not agree more. That literally would have been my statement. And, and it's important, I want to stress again, or just stress, period, that I hope that these things are, they become more diverse around in many, many locations because that's not very many places. We've got a lot of service members out there who suffer from the balance issues and the things that can benefit from this particular technology, and they're not going to be in the area where one of these machines may be. Fortunately, I'm in the D.C. area. I'm about to retire here, and I've got Bethesda for my treatments because, like I said a year and a half ago, the L5S1 area was the one that I had fused a year and a half ago. But the L4, L5, I was told by that same surgeon who's batting 1,000. Everything he said to me came true. He told me that between the next 5 to 7 years, I'm probably going to have that one fused as well. But that's due to the disc disease and that kind of thing that I've got going on. So I'm going to be looking for this particular machine in the hospital at Bethesda.
Agreed.
That's
Pam,
fantastic.
You have a question?
Yes. I was wondering if you spoke to quality of life earlier, Chris, but we didn't get that much time to delve into it. I think a lot of family members deal with their service member or veteran PTSD, TBI, and all of these issues that we're speaking to today. How specifically has this spread out, perhaps to your family, but also to your friends and colleagues and other folks that may be in that broader circle of yours? How has this program influenced that big circle?
Well, TBI is starting to gather a lot of momentum in the service. I can tell you we now have mandatory training briefs and that kind of thing that we used to didn't have. But let's face it, we all know that the PTSD gets a lion's share of the ink, and it's a lot of severity there. And there's a lot of quality of life, family issues and stuff that stem from PTSD. But also from a psychological, and Doc, I heard you say it first, I think, that level of depression that comes from a chronic pain sufferer is horrific, and it's going to affect every facet of that individual's lives, to include absolutely the family. But I can tell you that by the strengthening of my core and being able to delay coming to the point of pulling the trigger, I call it, one day, like a surgeon told me, he said, one day you'll make a decision. He said, I don't know when it's going to be, and you don't know right now either, but one day you'll wake up and you'll say, that's it, it's time to have this procedure done. And that's what happened. But it was 3.5 years after he told me that. So I can tell you that having delayed as long as I was able to delay having that procedure, that in itself tells you that my pain levels were reduced to the point that it kept me out of that abyss of depression
Right.
because of the psychological issues that chronic pain endures.
And I think that's important. I think when you're looking at this chronic type of pain and the depression that comes with that, and Linda, you spoke to it earlier, and how that does affect families and everybody around you. You're depressed, and people are like, I wish you wouldn't be. Well, you're in chronic pain. That's really, really a challenge. And so I think that it's a blessing that BalanceBack was able to help you overcome some of that to the point where you're like, okay, I can manage and I can look at myself strategically and say, okay, I don't need this surgery for 4 years. I mean, that's really telling.
Well, there would be days I couldn't come to work without being stooped over, and everybody knew that I was having an issue, but my frame of mind was to the point that, yeah, I might be humpback and crooked, but at least I'm laughing about it. So
right. You have an excellent attitude. I want to make sure our listeners have some resources to go to find out more about BalanceBack and to ask if your hospital has this or will get it, because there is a mobile version. You can go to balanceback.com. That's BALANCE back.com. And then another resource that's very good for vestibular disorders, the inner ear disorders, is VITA, which is vestibular.org. Two very good resources to find things out. I think a lot of the problem with VAs going broad-based with some tools, diagnostics, and even pharmaceuticals is that it's not known. And so if patients don't ask and don't request or say, I really wish you'd try this because we've tried everything else and nothing else has worked, sometimes that direct request really does make a difference. So for those of our listeners who are suffering from the lightheadedness, the dizziness, the imbalance, maybe falls, motion intolerance, any of those things, ask your physician, your care team about this tool, because if they haven't been able to get to the bottom of it, where is the harm? But the good that could be formed could be spectacular. And I think we all know that if you treat something and it's over, it's a lot less costly in terms of human capital as well as financial capital. So by all means, ask your physicians about BalanceBack to see if this is something that could help you. Marie, is there another resource that I've missed or something that would be helpful for our listeners? We've got about 4 minutes left.
They can always call at 1-877-63-DIZZY. And, of course, VITA, which you mentioned, is a great resource because they have a listing of clinicians around the country that test and treat for balance disorders. So that is a great, an excellent resource, and I would go there if you're looking for a clinician that would be able to assist with any of these types of issues.
Great. Sal?
Well, I was thinking as you were talking about the financial implications, and if I were a hospital administrator or an administrator of a senior resident, what I'd be concerned with is the cost of people falling. Mm-hmm. How much does it cost every time somebody falls? And the cost of a fall is huge. I would want to do anything that I possibly can do to help people with balance problems, with dizziness, with lightheadedness, in order to keep them from falling. In the long run, a diagnostic test, some therapy can save tons of money, in the long run, if we just think forward and we think ahead.
Which is a difficult thing for a government bureaucracy to do sometimes. And so that's why I encourage people to request this help, because there's a very good chance they're not even aware of it. Mm-hmm. Is that accurate to say, too?
Absolutely. And most physicians are not aware of this, too.
Right. And you were very lucky that Dr. Moore did, Chris. Anything you'd like to add? We have about a minute left.
Well, I'd say that I'm very fortunate in as much that there was that Doc Moore had that particular equipment there on the base that I was stationed at, and now here I am in the D.C. area, and I've got Bethesda where they still have it because, like I said, in about I don't know, maybe 5 or 6 years I may have to use it again, but I'd like to say that I really do hope that the VA gets this more widespread, simply for the fact that I'm grateful the TBI is gaining momentum as far as training and teaching us while we're active duty to help treat it and to seek out treatment for it. But also anything that helps my Marines to get better, how am I going to say no to that?
Excellent point. And in many cases, it's the smaller things in the scheme of things. When you come with a laundry list of physical injuries, balance may not seem like a big deal. But in life, as you have taken care of the other issues, being able to stand, walk upright, and feel stable, those are very much quality of life issues. Thank you so much for sharing this with us. Marie, it was a pleasure to meet you and just serendipitously find out about this tool. And I am so grateful to Sal and Chris and Marie. Thank you, Pam. This has been a very informative hour. And don't forget to go to BalanceBack.com for more information. Ask your physicians about it at VA. And vestibular.org for additional resources. I think that balance issues and these disorders can be diagnosed much more easily these days, and if they know about it, it will make life better. Thank you for listening to Military Network Radio. We'll see you again next Tuesday at 10 a.m. Eastern. Have a great week.
Thank you for tuning in today to Military Network Radio. You can find our show at our website, www.toginet.com/Military Network Radio. Also, www.militarynetworkradio.com. And in iTunes under Military Network Radio. Join us next week when we bring you another program to enhance